Doesn't your mouth health directly affect your heart health?
100%.
Oh, you guys did it at the same time.
Jinx.
Like how does that?
I mean, the inflammation is a big piece.
Okay.
Right. There's so much that research has been done on immunity and immune source and stuff like that. And I think the big piece is inflammation is also your body working, right? And our bodies have limited resources to fight things and work on things and fix things. So having inflammation with your mouth and your teeth, around your teeth, can take away resources from protecting your heart. Obviously, there's also dental infections can lead to endocarditis, which is infection or inflammation of like cardiac tissue or heart tissue, right? So I mean, and then there's like a ton of other stuff.
Yeah. As like the inflammation thing is like the biggest thing I always talk about with our teams too, that like, yes, we can do a lot of the fun and sexy stuff, make people's teeth straight, veneer them, and they love that. And that's, that's good and great. Yeah. But the most important thing we do in a dental office is control inflammation. I think like that, like if, like I would fight anybody on that, like that premise. Like I really think it's the most important thing we do. So, when you go to the dentist and they're sticking things down your gums and calling out a bunch of numbers, it's really, that's what we're tracking and that's what we're looking for.
Interesting.
Is inflammation, because if, us doing the cleanings and, requiring you to have additional cleanings and come in more often and that kind of thing is all, the premise around it is like we need to get the inflammation under control.
Yeah.
Because that's the one thing that we do that's not isolated to the mouth.